Good evening, late evening, in fact. We'll try our trial of quiz first. So, what is the rule is that there will be total 25 questions. The first 20 questions for the main quiz, and the last 5 questions will be used in case of tie. And each questions, there will be 4 options, A, B, C, D. Only one absence is correct. You will get to see the images or video clips and then the 4 options for 15 seconds, and you will get 10 seconds to respond the voting panel, and you have to select a single option and then submit. You can move aside the voting window if you wish to review the options. Even after 5 quiz, the last 5 I will show you, if there is a tie again, the participant with the fastest response after launching the voting panel will be the winner. So first, these are the 5 quiz I'll show you is the trial of quiz only to acquainted with you, how the main quiz will operate. So these trial of 5 quizzes will not bear any marks. So this is suppose this is the trial for quiz 1. So what is your diagnosis? Sand flow, water plus, color burst, cloud burst, and the hurricane. Now the voting panel is on. It will go after 10 seconds. You can choose the options and submit. And of the poll, what you can see, the number 1 is the 50% is the response is A, that is the sand flow. Yes, this is correct. This is a sand flow in a seashore. This is a trial for quiz 2. This is the trial. Quiz 2. Well, so these are the options. What is your diagnosis? Option in front of you. Voting panel on. You submit your options within 10 seconds. Yeah. Somebody has said, majority has agreed there is the option A, there is a whirlwind is the answer. Yes. Now you can see there is a beautiful abstraction of the mesmerizing whirlwind consisting of white small particles whirling on the background. Now this is a quiz number 3, trial quiz 3. This is basically ultrasound of certain things. Well, I'll give the options. These are the options in front of you. You can keep aside the voting panel to your right and left, particularly on the right side, there is a space if you want to see the options clearly, even after the voting window is on. And you can submit your options, and it will automatically go, all the voting window will automatically go after 10 seconds. Answer is, a majority has given answer is jellyfish, but unfortunately, it's not correct. This answer is USG of It is ultrasound of raspberry. This is the trial for quiz 4. This is basically an MRI of some creatures. Actually, there is a 2 clips. Whenever in the main quiz, I'll show you multiple clips. I'll tell you there are multiple clips, and you'll see all the clips. Then we'll give the options. This is the second clips of the same quiz number 4. Well, again, the options are in front of you. Remember, always choose only one of them. Otherwise, it will not be valid. It will not be valid. But while doing the main presentation, number B, that means MRI of lotus. Unfortunately, it is also not correct. It is the MRI of cabbage. And last trial for the quiz number 5. And probably we'll be in time for the main quiz. That is 9:30. After that. So this is the last quiz, and this is the option. What is your diagnosis? And submit your last options for the last quiz. And will be, yes, majority is agreed, almost 48% and 42%. It is divided between the A and B, but this B is correct. That is an ice frost forming process and the beautiful window freezing. In fact, I finish with the note. So this is also a quiz. See, this is a picture, beautiful picture. It's taken in the Somoridi Lake in the absolutely the upper portion of the Ladakh. There is a 300 kilometer away from the Ladakh. Do you know this? To get these pictures, you have to have 3 very important things. One thing, that there should not be any wind. Third thing is clear sunshine. And third thing is that there should be absolutely white sand in a clear water, so that you can get the absolutely clinch-free mirror image of the mountain within the lake. Thank you. And now I'll stop sharing this screen, and I'll share another screen. That is the main quiz. Okay, I have to go again. So this one, quiz 2000. So is a new share. So I'll stop this one and share screen. Why it is not coming? Let me give a minute. 2021 WB. Now share screen. Okay. We'll go to the full screen. Well, absolutely okay. Everybody is audible and visible. My screens are visible. Everything is visible. I'm audible.
Yes, sir.
Anybody can answer? Yes. Okay. So I'll start the main quiz. That is the quiz EZECHO 2020 and 2001. In fact, my the title slide is also a quiz, and that what is that flower, and that I'll give the answer at my thank you slide. So rules are the same. I'll again repeating it. Those who came late and the time, there is a total 25 questions. The first 20 questions for the main quiz and the last 5 questions will be used in the case of tie. Each question's 4 options A, B, C, D. Only one option is correct. You'll get to see the images or video clip for 15 to 30 seconds and then the 4 options for 10 seconds. You'll get to 10 seconds to respond the voting window. And you have to select a single option and click on submit button. Of course, if you want to see the options again, you can move aside the voting window if you wish to review these options. Even after 5 quiz, if there is a tie again, participant with the first response, which we can determine from the software after launching the voting window, will be the winner. So far, there are 20 questions is divided into five titles. First 4 is straightforward and a little simpler. So I'll go into the quiz number 1. This is the quiz number 1. Look at the M mode very carefully, and I'll give the option after that. Very, very carefully look at the M mode options. Totally. There may be multiple findings. So you look at it and find out the logical conclusions, and I'll give the options. What is your diagnosis in this M mode? Here are the options. And the voting window is on. And once after 10 seconds, it will give the audience response. Yes, the majority has given the aortic regurgitation. And answer is obviously correct. Is an increased aortic regurgitation because the increased duration between the E and A peaks and fluttering. If I go to the option, there is an increased difference between the E and A peaks, and there is a fluttering of the anterior mitral leaflet. Now is the quiz number 2. There is again a M mode. Look at this M mode very carefully and form a diagnosis in your mind so that you can quickly enter into the options. Well, these are the options. One is aortic regurgitation, cardiac tamponade. Here is the voting window is on. Once the voting window goes, they will give the response. The majority has given mitral valve prolapse. Yes, it is correct. It is mitral valve prolapse. Is a systolic bowing of the posterior mitral limb. I don't have to go to the slides again because they are fairly simpler. Next is this is actually the mitral valve prolapse, and this is the same patient we are taking the M mode. Now, quiz number 3. This is actually the continuous wave Doppler is taken near in the tricuspid valve. What is the arrow indicating, and what the image is showing? Look at this very carefully, and now I'll give you the options. So what is the cause in this color Doppler interrogation of the tear jet? These are the options. Well, voting window is on. You will give your options. Here it is almost divided into three, A, B, C, but majority has given in the A, and that is the correct answer. That is called tiger stripe sign. There is a septal tricuspid leaflet, oscillatory motions with the tear jet. So here we finish. So this, what is that actually? Tiger stripe sign. It's also known as the zebra stripe sign. Is the high amplitude band-like signal noted on the Doppler spectral recording. Either you can get in the pulse wave or even in the continuous Doppler, wave Doppler, or valvular regurgitation. These band-like signals appears to be associated with the intracardiac oscillating structure with the first band, that is the lowest frequency of the Doppler recording, representing its fundamental frequency. These structures vibrate with a single frequency with several harmonic overtones. That's why it's look like stripes. Now the quiz number 4. This is a single clip. Look at the clip very carefully and give your diagnosis in the next. Well, these are the options. The patient actually decompensated during a total hip arthroplasty. What happened? You can select your options in the voting panel. Yes, majority here is correct. This is fairly simple. You can see from the, you can see both RV dysfunction as well as a hint of embolus in the transit in the IRA. So it's a case of pulmonary embolism. So this is actually the case where you can see there is a large RV and the RA with a hypokinetic RV, and you can see the thrombus sitting even in the left branch of the pulmonary artery. So it's a major pulmonary embolism. You can see there is a hardly any flow to the left pulmonary artery. Now this is partial break for the quiz for all, not for competition. What is the MRI of? You don't have to, only the panelists can answer if they are not muted. Otherwise, I'll give you the answer. This is actually MRI of onion. Now, the next 4 set of questions is a little strenuous, not much, a little strenuous, like riding in the Great Wall of China. So, quiz number 5. There are 2 clips in this. This is the first clip. Look at the clip very carefully. The parasternal long axis view, and this is the parasternal short axis view. Well, these are the options. This is a 6-year-old child detected systolic murmur. What is your diagnosis? A voting window is on. Well, a majority has given 49% as multiple ventricular septal defect. But I must go in this case, uh, the answer is L kappa with multiple collateral scenes in the IVS. I must go in this view first. See, these are the multiple collaterals in the interventricular septum. You can see these are the multiple collaterals in the interventricular septum. But if you go to the next slide, you can see very beautifully there is a reversal of flow in the left coronary artery, and there is an increased augmented flow in the right coronary artery. You can see very beautifully this is the left coronary artery with the blue flow is coming from there. So this is a actually L kappa with, and now this is the angio of the same patient. You can see the L kappa. There's a multiple huge collaterals you can see here from this. So this is the quiz number 5. Now is the quiz number 6. This is single clip. Look at the image very, very carefully and what you can see in this image. Well, these are the options. What is actually seen? Yeah, you can submit your options in the voting window. Yes, 10 seconds. Majority have said ventricular septal rupture. But the answer is apical left ventricular thrombus intentionally outlined by colored Doppler. I must go to the image first. See, there is a large thrombus sitting in the ventricular apex. I have actually put the colored Doppler to show this is actually a thrombus. Is not going this. This is intentionally producing. There is nothing in the RV, nothing in the ventricular septum is absolutely intact. You can see in the both side of the septum there is a beautiful color flow and nothing is crossing along the septum. And this is the thrombus I have intentionally outlined by the color. Now the quiz number 7. Look at this, almost in the same area. Look at this, what you can see. Well, these are the options. What is actually seen? Yeah, voting window is on. Because it's in Webner, I cannot get any response from this. Here is the difference between the 36% and 30 C and D. Let's see what is the answer. Is a failed attempt to patch ventricular septal rupture in a patient with the cardiogenic shock. I may go to the EN. See, you can see the patch. There is a large patch is given, but it is a failed attempt. Still there is a ventricular septal defect. So you can see this. Up to this is a muscle. This is an after ventricular septal rupture. A patch graft was shown, but it is not up to the mark, and still there is a VSD. So it is a failed patch for Viesha. The C is correct. Now, quiz number 8. Look at this image. This is a saline contrast study. What you can see in this saline contrast study. It is a reversal. You will see reversal of saline contrast into the hepatic vein is seen after injection to the left arm vein. Why? These are the options. Yeah. Again, C and D is almost similar, 34 and 40%. But let's see. B is the least, and unfortunately, is a severe tricuspid regurgitation. See, whenever there is a saline contrast, if there is a saline in the hepatic vein, is almost due to the severe tricuspid regurgitation. Remember, is that in fact, before in one of the seminar, somebody has shown this type of slides, and I thought somebody has learned from it, and this because of the tricuspid regurgitation. So this is indicating of severe tricuspid regurgitation. Then after the second chapter, there is a quiz for all. It is again not for competition. What is the MRI? This is an MRI of something, and nobody can answer other than the panelist because everybody is muted here. So if anybody can answer is okay. Otherwise, I'll give the answer. So this is the second beat of the same picture. This is the second beat of the same picture, and answer is a banana flower. What we call in Bengali is a mocha. Now, in the third group, and the fourth question, a little more intricate. So, which number 9? Look at this, what you see in this image. What is actually seen? Right atrial myxoma, large vegetation in the RA, thrombus on a catheter in the SBC, right atrial tumor. Well, yeah, majority is correct. The 58% is given the correct answer. That is the thrombus, not a tumor, superimposed on a catheter in the superior vena cava, entering the right atrial cavity. So this is a simple one. So quiz number 10. What you see in this image? This is a transesophageal echocardiography, and what you see in this image? Struck aortic valve, thrombus in the superior vena cava, large aortic atheroma, left atrial appendage mass. Yeah, putting, you submit your options. Here is divided between 31% A and C. And unfortunately, nobody is correct. This is thrombus in the superior vena cava. See, if you look at this is not the aortic valve. This is actually a superior vena cava end-on view. It's taken at the 42-degree angle in this, and you can see the superior vena cava is totally filled with the thrombus. But somebody has differently recorded. Now, quiz number 11. Look at this again, a transesophageal view very, very carefully, and what you can see in this image. Well, everything is okay. Then we'll give the options. Here are the options. Here are your options. Voting window is on. Hmm. Once you finishes, we'll able to know. 36%, 29, 24, almost divided into everybody, but majority has given the last options, that is the pulmonary vein thrombosis, and he is correct. This is a pulmonary vein thrombosis. You can see here is the pulmonary vein is totally thrombus, inconvenient thrombus, the part of the thrombus is peeping into the left atrium. You can see the whole of the pulmonary veins get thrombused, and that is the correct answer. Pulmonary vein thrombosis. Now the quiz number 2 in the last in this panel. This is a myocardial LV contrast study with LV opacification in the short axis view. What you can see in this view. Usually we do not do the short axis pictures in the myocardial contrast. There is the varied reasons for that, but here is the for the quiz. Here is the quiz for the short axis view of the LV opacification by the myocardial contrast. Now here is your options. Yeah, voting panel is on. Well, majority has given the correct answer, that is 57% is negative contrast effect from the papillary muscles is correct. Now again, at the end is a commercial. It is the MRI of what? It is the MRI of garlic. Now a little more complicated is which we called it tangled. Quiz number 3. 13, sorry, 13. Quiz number, sorry, and quiz number 13. This is absolutely another new things I wanted to introduce. Look at the rhythm of this. In this, there is no whatever structural abnormalities you have to ignore. What is the rhythm in this patient? What is the rhythm? I have not given the ECG in this patient, but what is the rhythm? Look at these. What is the rhythm in this patient? Remember the rhythm. What you can find out the rhythm in this patient. Cardiac rhythm. Well, these are the options. Yeah, you can submit your options in the voting window. Yeah, again, the majority, 31% have given normal sinus rhythm, but majority, 42% is giving the atrial flutter, and answer is atrial flutter. See, this is the ECG of this patient, and you can see even now the ECG is on with the echo. And you can see the beautiful atrial flutter, or 4:1 or 3:1 AV block. Atrial flutter with the AV block. You can see very 3:1 AV block. So it's the atrial flutter. Page number 14. This is a single clip. What is your diagnosis? Yeah, you can submit your options in the voting window. Well, here is all 43% and 43%. Both are given C and D options. That means aortic dissection and RCC prolapse of the aortic valve. But here answer is dissection of the aorta. See, if you see this patient very carefully, so I have given a single clip from that one. This is basically aortic dissection, and you can see this is the picture I have given to you. This is the clipping, I cut it from here, and this is a picture of the aortic dissection. So aortic dissection is correct answer. Which number 15? Look at this image very, very carefully. What is the actually going on, and what is the image of this patient? What is the image why I am trying to show you? Well, these are your options. Yeah. Which number 15? Voting window is on. You submit your options. Yeah. Again, 28% and 28%. So diffuse atheroma of the aorta, and is the B option is that endovascular stent. The answer is again is endovascular stent graft. Here is a patient. Patient is a traumatic rupture of the uh, traumatic dissection of the aorta in the arch of the aorta. And this patient was put on the endovascular stent, and this patient was absolutely relieved with that. And this is the endovascular stent in the transesophageal echocardiography look like. Because you can see, if you go to this, that there is a lot of these endovascular stent is on, and you can leave a lot of, because of the metallic one, there's a lot of acoustic shadow you can see here. So this is basically endovascular stent graft. See, the current indication of the endovascular, I little one more 30 seconds, stent graft placement in the type B dissection, we can do it. Very particularly, there are few indications there where the acute or contained aortic rupture, symptomatic ischemic branch vessels involvement, early aortic expansion, and unrelating pain. Now, quiz number 16 in this category, the last quiz in this category is a quiz number 16. There are two clippings in this. This is the first clip you see. Certain things in see here, certain, you can see it, and in the second clip also you can see something is in the, you can see it. Now here is your options. The voting window is on. Yeah. Majority is correct. 71% is correct. Absolutely. This is a pacing lead is coronary sinus. 71 pacing lead. And you can see the pacing lead is in the coronary sinus, is the dilated coronary sinus, and the pacing lead is in the coronary sinus. Now, in between, there is a quiz for all, not for competition. This is an MRI of what? This is MRI of C arching. Now, the last group of 20 questions is a challenging one. So here you can see quiz number 17. There are two clips in this. Look at the clips very carefully. There are more than one findings in those clips, and look at this clip very, very carefully. Well, these are your options. Here is your voting pad. Here is it absolutely divided into three: A, C, and D. And let's see what is the answer. His answer is in accessory mitral valve tissue, that is called ACMVT, and the Epstein anomaly. C is the correct. C, there is an accessory mitral valve tissue absolutely impinging from the mitral valve to the LV outflow tract, causing a little more obstruction into the LV outflow tract. And next is, you can see this is an Epstein anomaly. We can very clearly see in this clip. Quiz number 18. Here is a multiple clip. You can see 4-5 clip. You can see all the clips, and then form your diagnosis and give the options. Well, these are your. It is an 8-year-old boy detected mum in the precordium. What is your diagnosis? Now voting pad is on. Well, here is again A and C, in between the A and C, but A is given the maximum response, but C is correct. Is a caught triatrium sinistrum with severe obstruction to the pulmonary venous flow. And I don't have to explain it, because if I go into the other EN, you can see this is a huge caught triatrium sinistrum. You can see it. This is the whole of this starting from here, and you can see the obstruction is going from the there is a not much of obstruction directly to the pulmonary vein, but there is some turbulence here, and here is again, and this is the end on view where you can see this is there is a membrane is occupying the whole of the left atrium, and it is going around the pulmonary venous flow is going around this to reach the mitral valve. This is a pitch number 19. There is a history of cardiac surgery, and look at the clip very carefully. And some cardiac surgery has been done, and here is the ECG of the patient, the post-operative. Look at the ECG also very carefully in each and every leads before we go to the options. Well, what surgery was done? Keep your options in the voting window. Well, here it is divided between the B and D, the septal myectomy and the cardiac transplantation. But cardiac transplantation is the correct answer. I'll give you why. See, this is the two P waves in the ECG. And if you see this one, this is the absolute donor atrium, and this is the recipient atrium containing all the pulmonary veins. You can see the all four pulmonary veins here. And if you go to this, if you do the tissue Doppler velocity in the donor one, it is absolutely beautiful excursion of the atrial myocardium compared to the recipient one, which is diseased one, the hardly any contraction. Quiz number 20 of the last of the main quiz is a 25-year-old male, history of surgical repair of VSD 5 years back, presented with episodic palpitation, a continuous murmur accentuated in the diastole at upper left and the right sternal border. There are multiple clips you can see. This is the first clip you can see. This is the second clip. This is a continuous wave Doppler. This is the third clip in the pulmonary artery Doppler over the pulmonary valve. And this is another clip. And this is the probably the last clip. Now, this is another clip, last clip, probably the last clip. What is your diagnosis? Voting panel is on. Well, a majority has given the aortoatrial fistula, and that is the correct answer. Why I'll show you, this is the very clue I have given you. From the go to the first one, if you see, it looks like there is a tricuspid regurgitation, and there is a gradient of about 4 meters. But when you go to the pulmonary valve, this the mean pressure is normal. So this is not the tricuspid regurgitation. So this is actually the aortoatrial fistula. This is the is coming here. And when you go to this area, you can see directly from the aorta to the left atrium, there is the aortoatrial fistula. And this is the gradient of the aortoatrial fistula is going to the 4 meters, same thing. So this is the aortoatrial fistula. Now is a quiz for all, not for again for competitions. This is the ultrasound of what? This is the ultrasound of jellyfish. And sometimes in echocardiography, you will get the large pleural effusion with a collapse of the lungs and looks like the fimbria of the jellyfish. And this is called the jellyfish sign in ultrasound. I told you that I'll give the answer in the even last stage. What is the flower? This is actually tea flower, cha. Now, if there is a tie, then another 5 questions I'll give you. Then these 5 questions will be taken into account. So everybody will respond this to the 5 questions because nobody knows who will win the tie because it's in the machine, and we already have announced that because of the logistic constraint, once the Zoom meeting ended, we cannot tabulate who is the winner. That's why we kept 5 questions if there is a tie. So pitch for tie 1 is ultrasound of lung. This is an ultrasound of lung. What you see in the ultrasound of lung? This is an ultrasound of lung, and what you see. These are the options. Yeah. Well, now voting window is on. You can give the options. Majority has given the D, that is the lung abscess. Unfortunately, it's not correct. It is an air bronchogram. And you can see this is, and these are the actually the ER-GOM program. These are the areas of consolidation, and this is the area, this is the linear appearance of the ER bronchogram. Which for tie number 2. This is the video clip you can see in this, and this is, and I'll give the another ECG of this patient, and I'll ask the option for that. What is your diagnosis? Yes, voting pad is on. Well, yeah, majority is correct. 57% is given the arrhythmogenic right ventricular dysplasia. This is correct. This is a case of arrhythmogenic right ventricular dysplasia because you can see the epsilon waves, classical epsilon waves in the V2 and V3. So it's a arrhythmia. Which for the type 3, this is a patient on ventilatory support. I'll show you echo clip and ECG clip and give you a diagnosis. This is the echo clip. And this is the ECG. Well, now here is the options. Yeah, voting window is on. You submit your options. Yeah, majority is correct. 54% is the pulseless electrical activity. This is actually a pulseless electrical activity. Because in fact, what happens here is actually the patient is already dead and there is no flow inside. Only the ventilator patient was in ventilator. That's why the movement of the heart is seen. And you can see the ECG is totally measured like pulseless electric activity that can persist even up to a few minutes to few hours. And in a case of pulseless electrical activity. And quiz for type 4. Here, what is the look at this video clip very carefully, and I'll give you the options after that. What is your diagnosis? Yeah, voting pad is on. Yes, you submit your options here. B, options, and A also evenly distributed. That is the coronary cannular fistula with bicuspid aortic valve and the bicuspid aorto-LV tunnel. And these are the two options. Unfortunately, B option is correct. That is the bicuspid aortic valve with a large aorto-left ventricular tunnel. And you can see it very clearly in this picture. There is a large aorto-left ventricular tunnel. You can see in this picture. Bicuspid valve is well seen. And the last quiz for the trial is the quiz for type 5. So I'll give, this is a 25-year-old lady, the known case of congenital heart disease, primi gravida, presented for fetal echocardiogram. So I'll give you the 4 clips, 2 clips for the mother and 2 clips for the fetus. And you have to give both the diagnosis. So this is the first clip of the mother. Look at this. What is it? And this is the second clip for the mother. And this is the first clip of the fetus. Look at the clip very, very carefully of the first clip of the fetus. And this is the second clip of the fetus. Well, these are your options. The voting pad should on. Yeah, voting pad is on. And this is the last questions. Yeah, majority has written 39% is the B. The VSD pH fetus and VHD pH. So what should be the answer? Is the mother is the VSD and pulmonary arterial hypertension, fetus is TG. Also why? See, look at the mother is no problem. This is a VSD, large VSD, and pH you can see in this. There is a bidirectional shunt in this VSD. Fetus, if you look at the very clearly, both the atrioventricular valves are well formed. There's no problem with that. But if you look at this, there is a two great arteries running parallel to each other. And whenever in this fetus, this type of gait, you get it, the malpostate artery, or that time, you always diagnose this as a case of TGA. So answer is mother VSDPH, fetus TGA. Thank you.